everyone. Welcome to East and West Learning Connections. My name is Yang Wang. I'm the president of this organization. We create cross-cultural learning and communicating opportunities for people. So in the past 7.5 years, I believe, we have organized more than 270 cultural events for free. Thank you very much to come to this program. And tonight, it's our dialogue program. In this program, we invite people from different heritages to share their life stories, share their thought, concern. So at very individual level, we can know each other. We hope in that way we can learn from each other, break some stereotypes, and have fun. So tonight we are very much delighted to be joined by an amazing young Chinese American lad, Dan Xia. He is a first year student in medical school of University of Rochester in America, but he has traveled to more than 140 countries as a backpacker. And he has a lot of adventures. He'll introduce himself much more and his stories shortly. But he also created a clinic on an island in Kenya to help the people there. So amazing. When I read the story your father wrote about you, I was so amazed. Wow, that young man, like really an inspiration. So Dan, I'll give it to you now. Take it away.
Well, thank you all for the extremely warm welcome. Also, thank you for the very kind words that you have mentioned. And so I think today, like Young had mentioned, I am a first-year medical student at the University of Rochester. And so I recently just finished exams, so I'm really excited to be able to be here and have the opportunity to talk to all of you about the work that I've been doing in Kenya, as well as some of the travels that I've been very, very fortunate and privileged to have over the last few years. And then I think after that, I will probably give the rest of the time to like a Q&A session in case anyone has any questions. But yeah, so I think the first thing I want to do is I'm going to share my screen, and I didn't have any time to create a very, I guess, like cohesive or like big kind of presentation, but I do have some visuals that we can look at as I'm telling my story. And so, yeah, I think the first thing I want to talk about is the work that I do in Kenya. And so I am the international director of the Sagrema Foundation, and the Sagrema Foundation is a community-based organization on Mfangano Island. And here is a map of Lake Victoria in East Africa. And so Lake Victoria is one of the largest lakes in the world, and it's surrounded by a couple East African countries. And on the Kenyan side, the biggest island is called Mfangano Island. And so that is where that is, just for some context. And in the very beginning, the reason I had started this whole trip was because of COVID. And I think I will take a few steps back later to talk about how I got there in the first place. But in December of 2020, I went to Mfangano Island for the very first time. And my supervisor and the person that I was speaking to originally, his name is Samuel, and he's one of my partners at the Sagrema Foundation, and overall just a wonderful, wonderful guy. He is a primary school teacher, as well as the creator of multiple community-based organizations. And so and he is one of the village leaders within the Wakinga village. And so he knows a lot of the issues and the difficulties that the local people have had. And he has created a lot of, I guess, creative ways to help the members of his community. And when I began talking to him, it was very clear that that was something that he was very passionate about. And so that's something I wanted to be involved in as well. And so I went to Kenya in December 2020. And one of the projects that he had mentioned was starting a health clinic. And one of the things about Mafangano Island and within the Wakinga village specifically is that there at the time was no clinic that was reliable within, I guess, like a 15 kilometer distance. And because the island is very small and it is in a very rural part of Kenya, there was an inability for a lot of patients to get affordable healthcare access. And there was there's no like public transport, so everyone was kind of walking. And in order to, if someone was sick and very sick, they had to walk or had to be taken by motorbikes, and the motorbikes there are called piki piki, which is a fun name, but to get to the nearby uh, healthcare clinics. But then even then, if they were able to get there, there was oftentimes not enough medications that they needed, or there was not enough staff, or it was too expensive. And so one of the projects that Samuel really wanted to create was this healthcare clinic. I think there was a slight misunderstanding before I arrived to Fagano Island. I thought that there was already a clinic there, and I was just going to volunteer there. But when I got there, due to I think some language barriers, I found out there was no clinic. But I think his passion was something that really moved me, and I wanted to contribute to that. And then over the next couple weeks, we started doing some volunteering. And here's a picture of me with some the local women's group. And that is another organization that was created by Samuel and his wife. And so the woman to the left of me, that is Samuel's wife. And she created this, the Nyagat Women's Group. And the women's group is there to empower local women to be able to create their own initiatives, like things like creating a store so that they can make some extra money to feed their families and things like that. And so I think for me, fundraising was something that I already had some experience in. And I had already created a fundraiser for some of my travels. And so I decided to use some of the money that I had fundraised for those travels in order to kickstart, I guess, the creation of the clinic. And so over the next couple weeks, the biggest thing that I tried to do was to, I guess, we all worked on, we did a lot of manual labor. And I think that was something that was really cool, was that when the village found out that, that someone had come into that really wanted to create this clinic, everyone in the village kind of got together to create, to help do work. And so in the top right picture, that's me, I guess, cutting some metal. But the man in orange, that is Samuel. So he is the founder of the Sagrema Foundation. And to the left is just a local boy who wanted to contribute to the like removing some of the soil in order to level the field. And so what was really, I think, inspiring was that in the very, like when I first arrived to this area, there was absolutely no space for I guess a clinic. And so we had to take out all the weeds, all the vegetation, and to create a level ground. And so on the bottom right, we have some of the local women also working to help create a space for this clinic. And then I think one of the other reasons that I was really, really passionate about this project was because growing up, or maybe not like throughout my entire life, but I had studied global health in my undergraduate career at the University of Virginia. And combined with that, I always knew I wanted to be a doctor. And so one of my dreams was to, I guess, create healthcare clinics around the world and to be able to provide affordable and accessible healthcare services to patients around the world who didn't have those resources. And so I think this was an opportunity for me to complete half of that dream, which was to create the clinic. Even though I was not a doctor at the moment, I figured that this was something that I was able to do and to contribute. But I personally did not have any idea of how much I would be able to contribute. And so the entire process of this clinic coming together was, I think, a very humbling experience. And I guess in terms of like the need in the island, I had mentioned that there was a lot of patients who just didn't have healthcare access in general, and were not able to get a lot of like affordable medication, and perhaps like the healthcare clinics that were existing were a little too far away. But I think something that I was particularly passionate about was also the maternal health issues on the island. And in a lot of rural countries like Kenya, midwives are one of the ways that families are able to deliver babies. But when there are complicated births, that is not something that midwives are often able to help with. And so they have to get carried down, perhaps like, let's say, a mountain. And then there has been an emergency boat on the island that was founded by one of my mentors many, many years ago. And then, so then the mother who perhaps has a complicated birth has to go down the island, go down the mountain, maybe get carried by her family members, and then take a motorbike down to where the emergency boat is. And then from the emergency boat, the boat will take them to the mainland. And from there, they're able to go to a larger hospital that perhaps has the services to provide care for these mothers. And so one of I think, dreams that we had in creating this clinic was creating a space where mothers can give birth at like at our clinic. And even if there are complications, that we would have medical staff that would be able to serve those populations as well. And so this is, I guess, the beginnings of the construction. And so you can see some of the local men who are helping with the building. And this was like the very, very first iteration of the clinic. And this was within, I would say, about a month of us working. And so every day, like I would wake up at maybe 6 o'clock and do some manual labor. And then in the afternoon, when the sun was really hot, I would try to do some fundraising. And a lot of the fundraising was just within my circles, my social circles. And I primarily used GoFundMe. And then I was very fortunate to have very supportive friends and family who would share with their friends and family. And so within, I think, the first month and a half, we raised maybe $6,000 or $8,000, which was great. And we used that money to purchase like the metal rods you can see, the metal sheets for everything, and like the windows and things like that. And all these things have to be bought on the mainland. So it was pretty expensive because we have to buy it on the mainland and then take the ferry back to the island. And then, so everything was a little more expensive to get things on the island. But yeah, this was after about a month and a half, I would say. And then, okay. And so after, I think, 3 months, I think, especially something that I had learned from fundraising is that there's typically like an initial like surge of donations, and then it kind of dwindles down after a little bit, because a lot of the people who would donate have already donated, and there is, I guess, less urgency to like share from other people. And so at I think our donation and fundraising kind of slowed down a little bit after 3 months. And within 3 months, the Wakinga Community Health Center, as you can see, is named here. This is what it looked like from then. I see. I saw someone had raised their hand, but that went away. But yeah, and so that was my first time in Kenya. So I spent 3 months there, and I really one of my biggest goals there was to really be involved in the culture and really involved in the community. And so I spent a lot of time studying Swahili and Luo. Luo is the tribal language here. And so, and then within 3 months, it was really great to see community members, like when they saw me, they would call me Dan instead of Mzungu, or Mzungu means like white person or generic, because I have fairer skin than a lot of the community members. They just call me Mzungu in the very beginning. But I knew that I had been welcomed into the community as they were began to call my name, which was I think something that was really touching as well. And then during this time, I also did some teaching at the primary school that Samuel worked at. And so that was something that was really great as well. And I love teaching, and I love like spending time with children. And so those were, I think, my main projects in the first like month and a half, or like the first 3 months, first time that I was in Kenya. Something else that we had worked on from other volunteers was creating a clean water project. And so um, when after I did a lot of the fundraising, Samuel appointed me as the international director so that I could continue to fundraise for projects such as the Wakinga Community Health Center, but also so that I could be a contact point for other volunteers who came who had their own project ideas. And so this project was not originally my idea, but I think another like college student who wanted to create I guess like sources of clean water for the community. And so this is another project that we worked on. And so this was not originally my project, but this is something I think that we're also very proud of within the Sagrema Foundation. So I wanted to show it here. And this is one of those sunsets on the island, which was absolutely beautiful. And every day seemed like a paradise. And for those of you who cannot see this image, it has purple skies, and you can see like cotton candy clouds. And I'm sure none of you can hear this, but in my head, looking at this picture, I can hear the waves crashing. And it's just a really wonderful place to spend my time. And it was very rural, so there was not much electricity, not much running water as well. And so spent a lot of time, I guess, just appreciating being in nature. And I bathed in the lake as well, which is a very fascinating experience because I have seen like hippos within the lake, and they are pretty dangerous. So, but as long as you don't try to provoke them, they're not going to come to you. But yeah, I think being in nature was just like an incredible, incredible thing. And there was so much fresh fruit all the time, and we could just pick passion fruits off the trees or mangoes, and they'd be the freshest fruits that like I'd ever eaten. So I have very fond memories of this place. And so the next year, so after I came back from Kenya the very first time, I went back home and started teaching in America, back home in New Jersey. And then I continued my fundraising efforts, but it was a little difficult because now I wasn't in like on site. And so a lot of my work was I did try to continue fundraising and writing grants. And but then that was when a lot of other volunteers would go to the island and have their own projects. And a lot of times their volunteer projects are just helping with like farming. Some of the sources of volunteers for the Sagrema Foundation have been through WOOF. I'm not sure I forget what WOOF stands for, but it's for people who want to volunteer in rural farms. And so that's where a lot of our volunteers do. And so they help with like the plowing and the seeding of the soil there. But yeah, and then after another year, I went back to Kenya, and we restarted some of the fundraising campaigns, and I worked with a lot of different volunteers. I organized a lot of different meetings with stakeholders, as well as like the Ministry of Health in Kenya. And so we were able to get a lot of support from, I think, my supporters, as well as from the government, the Health. And so within another month of me being there, we were able to start treating patients. And this, as you can see from here, this is our very first patient. Our very first patient is on the right, that's Marilyn. She is Samuel's wife. But then on the left was our first nurse, and she helped she helped staff our clinic for several months. And then during this time, the donation money that we received was to improve the building overall so that it was a little more sanitary and that there was clean water and stuff like that. But we also purchased a lot of medications. So here, those are. And something that was, I think, a fun idea that someone had brought up to me, and then I thought this would be a great idea to thank some of our benefactors, was to create this tree um, for the people who had donated. And so you can see on the screen, it says Wall of Benefactors. The Wakinga community expresses gratitude to the following donors. And so we have Samuel Odoyo, who is the supervisor of the Sagrema Foundation, or the founder. There's me, and then there are a couple other volunteers who have contributed to this project as well. And then there is a tree with a bunch of leaves, and each of these leaves has some of the donors' names. And this is just like, this is an incomplete picture, but this is just the picture that I had on hand. Yeah, and then so within a month and a half of the second time I was there, so this was about a year and a half after my very first time going to Kenya, we received approval from the Ministry of Health to begin operating as an official clinic. And so this is one of the documents that they gave us, and it's an outpatient register where we can record patient visits and stuff like that. But it was given to the Ministry of Health, and I thought this was a great symbolic start to our clinic. And I think this was just the culmination of, I think, everyone's efforts involved in. I think I was very humbled throughout this entire experience because there were a lot of challenges that we can talk about later. But it was also a very incredible learning experience, and something that could not have happened without the supporters like from all around the world. So that was an incredible thing. Here are some more medications that we were able to receive. And then this is Jack. He was our second nurse to begin working with us. And you can see in the back, we had created this storage unit for the drugs as well. And then we have another patient here. And she had given us permission to use this image. So, okay. And so that has been overall like just a wonderful project that has been going on. But we always trying to find new ways to, I guess, to make an impact on the community. And so the third time I had gone back to Kenya, this was last year in June, in 2023. One thing that I had done during my undergraduate experience at the University of Virginia was a peer health educator. And so a lot of the work that I did as a peer health educator was doing health outreaches to teach my fellow students or the student body about safe health practices surrounding things like alcohol and drug abuse prevention, as well as just mental health stigma and things like that. And so I thought it would be a great way to use those skills to create like an outreach program within Wakinga Community Health Center. And so we would go to about every month or so, we would go to a local school. And this is the school that I had taught at with Samuel. And this was our very first outreach program. And so during my last time there, I wanted to create this project. And so you can see Jack, our second nurse, who is giving this talk. He is speaking in a combination of Swahili and Luo, so that he can speak to the students. The students all mostly speak English as well, because that is a language that every student in Kenya needs to learn. But he is speaking in their local languages, and helping them learn about safe, I guess, like clean water habits, or like make sure to boil your water or clean your hands. And I think these are things that we in the West often take for granted, or as like very simple and common sense kind of things. But in countries where like health education is not always the very in place, I think this was a very beneficial thing that was able to help some of the students here. And since then, we've had some other volunteers come in, and they have taught local teenagers about sexual health and mental health and a lot of different things. And that's something that is ongoing, although sometimes there is a little difficulty in the um, the money in terms of buying drugs for the outreaches and things like that. And so things have slowed down a little bit, but we had several other outreaches, and we had our last one, I believe, last month. So we were also able to provide free healthcare services to schools, and local community members could come in to get free healthcare as well. Whoops. And so, whoops. And this is another image of that. And so on the bottom, okay, so within the last year and a half, we've had a couple other volunteers come in and do their own fundraising. And so this is not here when I was there last time. And so you can notice that there is a little bit color change, but we have expanded the original clinic that you can see on the right here. And we've created a second portion of that on the left. And on the left side, we have several beds for a maternity ward, and so that is where mothers can safely deliver their children. And on the right, we have some more inpatient beds so that some patients can stay and rest while others are getting treated and stuff like that. And so here is the newest, I guess, like iteration of our clinic. And then here on the bottom, you see some of the local supporters and local community members who have made this new version of the clinic possible. I believe on the top, you can see some of the patients from this last community health outreach. And so there are a couple volunteers there who were helping out at this project, and also some of the students that came to receive free healthcare as well. So that was great to see. But I was in the middle of medical school, so I was not able to go back and see this. Okay, so that is, I think, overall, just an overview of some of the things, um, some of the work that I've been doing on the island. And I think I will take a quick break here. And if anyone wants to ask any questions about this part before I move on to the second part of, I guess, my journey.